Menorrhagia or heavy menstrual bleeding is not just an inconvenience. It is a serious health concern that could affect your day-to-day life, affect your relationships, or also lead to severe health complications. Today, we are going to look at some of the causes of heavy menstrual bleeding and how we can treat it. Welcome to my channel. My name is Dr. Raisha, a pharmacist and a fertility and women's health expert. If you are new to this channel, please do not forget to subscribe and hit the notification bell down below. So today we are looking at menorrhagia. Menorrhagia means heavy menstrual flow. Menorrhagia is menstruation at regular cycle intervals, but in excessive amount and duration. What do I mean by this? We said that a person with a normal menstrual cycle has 21 to 35 days. So this is normal. So when a woman has a cycle between 21 to 35 days, that is normal. And we said that when a person bleeds from 2 to 7 days, that is also normal. But we are saying that now menorrhagia is menstruation at regular cycle intervals. So maybe your cycle intervals are in between here, but in excessive duration. So you find this person is bleeding more than 7 days, is bleeding for 10 days, and in excessive amount. A normal person, when a normal person usually bleeds about 25 to 80 mLs of blood per cycle. And so when this blood is more than 80 mLs and this duration is longer than 7 days, then this person has what we call menorrhagia. What are some of the causes of menorrhagia? The first cause of menorrhagia is anovulation. This is when a woman fails to anovulate. Women who do not ovulate usually have heavier flow than women who are ovulating. What do I mean by this? This diagram here illustrates the menstrual cycle, and we have very many hormones that come into play in the menstrual cycle. We have phases of the menstrual cycle, such as the follicular phase. During the follicular phase, this is when the follicle stimulating hormone here stimulates the growth and maturation of follicles. Each follicle usually has one egg. And so during this time, there is also an increase in estrogen from the ovaries. And when estrogen is increasing, it is now telling the uterine lining, the endometrial lining in the uterus, to grow and proliferate, ready to house a baby. Tell them that the baby is coming, please be ready. And so, after now the follicular phase, the egg is released during ovulation. And after ovulation now, that follicle that remains forms something that we call a corpus luteum. So the corpus luteum now leads to the secretion of progesterone. And so now after ovulation, you see now the progesterone continues increasing like that. And so if fertilization does not occur, and no implantation takes place, then the lining of the endometrium sheds and menstruation occurs. And you can see now the levels of progesterone and estrogen go down. But if this person did not ovulate, you see here now, ovulation did not occur. So if ovulation did not occur, there will be no corpus luteum, hence there is no progesterone. And so when there is no progesterone, the levels of estrogen we said that estrogen leads to proliferation of the endometrium. So the endometrial lining continues proliferating, growing, it keeps growing until a point when now the blood supply is not enough. And so when the blood supply is not enough, it degenerates. But now it has thickened so much. And so when it proliferates, this leads to a lot of blood. And so that is how an ovulation leads to menorrhagia. Another thing is PCOS, the polycystic ovarian syndrome. We talked about polycystic ovarian syndrome in a previous video, and we explained that it is related to an ovulation. And so during PCOS, there is an ovulation, as we have explained here, and hence this person can have heavy menstrual bleeding. Another cause of menorrhagia is growths in the uterus. We are talking about fibroids. We are talking about polyps that could be growing in the uterus. In our previous video, we talked about fibroids. We talked about how fibroids, let me show you here. So we said fibroids could grow even up to 15 centimeters or more. And so when a fibroid has developed in the uterine lining, this fibroid has independent blood supply. The blood supply of a fibroid is not the same as that supplying the surrounding endometrium. And so now it is being supplied by its own veins, its own arteries. But now after being supplied by blood by the arteries, now the blood goes back through the veins so that it can go to the heart. But now you find in a fibroid, there is no return of blood. The blood does not return through the veins. And so the blood pools, the blood accumulates. And so when this happens, this weakens the endometrium. And so this could lead to something we call breakthrough bleeding. Another cause of menorrhagia is bleeding disorders. I believe at one point in your life, you've heard about white blood cells, red blood cells, platelets, and how when you've injured yourself and you are bleeding, platelets help in the formation of clots, preventing further bleeding. And so if this person has a bleeding disorder and maybe their body is not producing enough platelets, this person is at risk of getting heavy menstrual bleeding. Another thing is liver diseases. The liver helps in the formation of clotting factors. These are factors that are necessary that help the body to form clots and hence prevent further bleeding. And so when this person has a liver disease, there are no clotting factors that are being formed, and hence this person is at risk of getting menorrhagia. Another cause is drugs such as anticoagulants. So these are drugs that prevent clotting from taking place. And so when a person is taking this drug, they could get heavy menstrual bleeding. Another thing is an IUD. This is the intrauterine device that is usually used for contraception. And so when a woman gets an IUD, when a IUD is inserted in your body, for the first 6 to 12 months, this woman could have very heavy menstrual bleeding, characterized also with a lot of pain and cramps. And this is caused by the local irritation effects of this IUD in the woman's uterus. Another thing are infections. Infections such as the pelvic inflammatory disease could lead to menorrhagia. Another thing are hormones, maybe steroid hormones. These could lead to menorrhagia. When you have heavy menstrual bleeding, your doctor has to ascertain what really is causing this menorrhagia. And in that, the doctor carries out some investigation. The doctor can also take your history, asking you some questions so that they can be able to establish the cause of this menorrhagia. And some of the investigational procedures that the doctor could do are such as dilatation and curettage. Another one is hysteroscopy, whereby they are looking inside the uterus, trying to see, is there anything in this person's uterus? Is there any defect that could be causing this heavy menstrual flow? The doctor has to exclude the possibility of pregnancy in this woman. This is because pregnancy is the leading cause of irregular bleeding in most women of reproductive age. What are some of the things that could cause bleeding in pregnancy? These are such as implantation bleeding, ectopic pregnancy, or even miscarriage. So the doctor will do some tests to see if you are pregnant or not. The doctor will want to establish the quantity of bleeding. A normal tampon holds up to 5 ml of blood, whereas a pad holds up to 15 ml of blood. So you will find the doctor asking you questions such as, what type of pad do you use? How many soaked pads do you use per day? The doctor will also want to know the age of their patient. This is because if it is a young girl who just started receiving her periods, that time between when she first starts to receive her periods to her late teens, that is 18, 19, these girls usually have what we call an ovulatory cycle. This is because we talked about something that is called the HPO in a previous video. This is the hypothalamus, pituitary, and the ovary axis. And so this axis is in charge of the menstrual cycle. It regulates the menstrual cycle. But in these girls, this cycle has not matured. And so these girls will have an ovulatory cycle. This is whereby they do not ovulate. Another thing is that when women are between the age of 30 to 50, they are at high risk of getting growth in the uterus, such as fibroids and polyps, and this could be causing the heavy menstrual bleeding. Another thing they want to know is this woman postmenopausal? Because if a woman is postmenopausal and is having heavy menstrual bleeding, then we want to think maybe there is an underlying condition, such as endometrial cancer. They will also want to ascertain, are you having any pelvic pain? Because now pelvic pain is associated with other things such as pelvic inflammatory disorders or a pathological condition. They will also want to know, what is your menses pattern? This is because we have said that for young girls between the age of 12 to 18 years, these girls usually have an ovulatory cycle, and most of the time they have irregular bleeding, and it could also be associated with very heavy bleeding sometimes. But if it was a woman who had regular menstrual cycle, but at this particular point in time, now she started having heavy menstrual cycles or irregular menstrual cycles, now we will start thinking maybe of a certain condition. Another thing, the doctor will want to know, what contraception method are you using? We've talked about an IUD causing very heavy flow in between the first 6 months to 12 months after insertion. And we've said it is because of the local irritation effect that it usually causes on the uterus. Again, if this person was using a pill and all of a sudden discontinued the use of a pill, then the body returns to the natural flow. And so this person could be experiencing heavy menstrual periods. Another thing that we will want to see is, does this patient have something that we call PCOS? Because PCOS is associated with heavy menstrual bleeding. So they'll be looking at things such as androgen excess in their body. They'll be looking at things such as excessive hair growth or even obesity to look at, does this person has PCOS, and could the PCOS be causing the menorrhagia? Another thing, the doctor will ask you on the medication that you are taking. We talked about medications such as anticoagulants, which prevent clotting of blood and could be causing menorrhagia. They also want to know, does this patient have diseases such as renal disease, such as liver disease? We've talked about how liver disease leads to decreased clotting factors and hence increasing the risk of a person having heavy menstrual bleeding. The doctor will also want to know the sexual activity of this patient. This is because some organisms that are sexually transmitted, such as chlamydia, could lead to menorrhagia. Chlamydia causes what we call postpartum endometritis, which causes heavy bleeding in women after delivery. Again, it could also cause discharge that is mixed with blood. Infections such as candidiasis or bacterial infections could cause intermenstrual bleeding. And so now, after ascertaining all this, now the doctor could go ahead to treat your heavy menstrual bleeding. And some of the drugs that are used in the treatment of menorrhagia are such as NSAIDs. NSAIDs are drugs such as brufen, diclofenac, ketoprofen, mefenamic acid, all these drugs. These drugs, they reduce the synthesis of something we call prostaglandins, and hence they reduce menstrual flow. Another drug is the oral contraceptives. Oral contraceptives, they inhibit the production of follicle-stimulating hormone and luteinizing hormone by the anterior pituitary gland. They also inhibit the production of estrogen and progesterone. They inhibit follicular development, and hence they inhibit ovulation, and this could reduce or inhibit menstrual flow. Another drug is progestin-only contraceptives. Progesterone is usually anti-estrogen in the sense that when progesterone increases, estrogen decreases. So when progesterone is introduced into the body, it reduces the amount of estrogen. Estrogen is necessary for the growth of the endometrium. And so when progesterone is introduced, it reduces the amount of estrogen, hence reducing the growth of the endometrium, and this prevents heavy flow. I want you to note that these progestin-only drugs should not be used as mode of contraception in this case. This is because we said that when this person does not ovulate, progesterone is not formed. And so now, when you give them drugs containing progesterone, you have introduced progesterone into their bodies. And so when you introduce progesterone into their body, these people could ovulate and hence they could get pregnant. Another thing is the intrauterine device, the IUD. Somebody will ask me, but you said it causes menorrhagia. How will it treat menorrhagia? Because we said that yes, it causes heavy menstrual bleeding for the first 6 to 12 months. But after that, now the flow starts becoming regulated until to a certain point that now it could even stop completely. And this person will not be receiving their menstrual period. So the patient is advised to become patient. Do you hear that? The patient is advised to be patient as the periods will regulate with time. Another thing are drugs such as tranexamic acid or even gonadotropin releasing hormone agents or even drugs such as danazol. And there you have it, guys. If you like this video, please give it a thumbs up. And if you have not subscribed, please do not forget to subscribe and hit the notification bell down below.